Welcome back, everybody, to the Kiss Me Med Spa Show. I'm Nurse Karen, and today I have a very exciting guest with me. Her name is Lindsay, and she's with Barrow Aesthetics. Welcome, Lindsay.
Thank you, Karen. I'm so happy to be here with you
Yes,
guys.
I'm so glad we finally got you up here. We're in Central California, and she's in Southern California, so she very kindly drove up for our interview today. So what we're going to be talking about today is Toskani Med. Now, I learned about Toskani probably 3 or 4 months ago. I think it was that I went to their first big introductory meeting down in Southern California. So she is an expert on these products, and I'm very excited to have her answer a lot of questions that you might have, and also some that I have. So Lindsay, what is Toskani Med? Give us an idea about the history of this company and let us know all about it.
Yeah, so Toskani Med is a company based in Barcelona, Spain. The company itself has been family owned by the same family since 1953. They did expand into the aesthetics world in 1994 under the Toskani name. So really what they are known for is creating different customized skin cocktails that we use with mesotherapy or mesoneedling. So they are really just known for being a skin health company in Barcelona. And now here in the US, we're very lucky to have just gotten Toskani here through the FDA as well.
So yes, it's very difficult to get FDA-approved products here in the United States. So that's a very important thing.
Yes.
So what do you see is the biggest benefit of the Toskani Med products?
Yeah, so I look at Toskani as kind of like, you know, the salad for the outside, right? We all eat very healthy to try to take care of our insides. We eat fruits and vegetables. We take supplements. We try to get all of those vitamins inside our bodies to keep us, you know, more youthful, healthier, more active. But we sometimes neglect the outside. So what Toskani is able to do is we're able to get those little micronutrients, all those vitamins, minerals, amino acids, all of the growth factors, peptides, everything that our body needs inside, it also needs on the outside. So we're able to use mesotherapy to deliver those ingredients into the skin topically so that we get that nice health on the outside too.
Oh yes, lovely products. So mesotherapy, mesoneedling, is that the same thing?
It sure is. So it's very similar to microneedling. Microneedling is just going a little bit deeper into the skin where you're getting, you know, that bleeding effect, where that is the outcome that you're looking for, is to cause bleeding with microneedling, where mesoneedling is a little bit different. They are shorter needles that are designed to create those channels like microneedling, but without the blood that pushes things out. So what we want to do is infuse in.
Yes, that's one thing that they really stressed and drove home at the conference was if you are getting bleeding when you're needling, that is too deep for these products.
Exactly.
So we want to be more shallow in the tissue so that when we massage the products on or in, they're going right into the perfect layer of the tissue.
Perfect, yes. They're just sitting in those nice little channels that we make in the skin and getting all of those nice micronutrients into our skin cells.
So basically vitamins for your skin.
Exactly.
Love it.
Yeah.
I absolutely love that. So we're talking a little bit about the Exceed device. I see that you have the handle there. Tell us a little bit about that. Just once again, briefly, how it differs from all the other types of microneedling devices there are out there.
Sure. So the Exceed is kind of special in that not only can it get really, really, really shallow in the skin, you can take this all the way down to just above 0 and create really, really tiny channels, but it can also do microneedling as well. What's really nice about this device specifically that I love the most about it is that the tip, the cartridge on it that has those little needles, there's a little plate that kind of fluctuates with the contours of your skin. So you're able to go around areas where, you know, typically we wouldn't be able to use microneedling, and we're able to keep every single channel on the face perpendicular to the skin so that all of those micronutrients are going in at the same depth in the same direction. The other nice thing is because it can get so shallow and it's, you know, so gentle in terms of kind of gliding with the contours of the face, you can even treat the eyelids, you can treat the lips. So you're actually able to treat more areas because of how gentle this is. Every single channel is the same exact size, same direction, and it doesn't create that dragging and tearing. So we're creating the least amount of trauma possible to make sure that we get our vitamins.
Yes, and our patients who have had this treatment done, they love this device. And I've actually had this treatment done with that device. And I love the fact that it was very simple. It was not painful. I did not have any bleeding with it. And also the fact that it's so quiet.
Yeah.
It's just really a nice device. I think that it's like the regular microneedling is first generation. Now we've progressed to something a little more sophisticated that's a little more luxurious.
Yeah, I agree.
I really like
nice
the device.
Experience.
So talk to us about what we have here on the table.
Yeah, so Lumicin is our sodium DNA product. This is derived directly from salmon DNA, which I'm sure a lot of people have heard about. It's getting very popular on Instagram and TikTok for the salmon facials and things like that. What is special about Toskani's Lumicin specifically is not only is this a pure sodium DNA, but it's also the highest strength available on the market here in the US. So this is a 3% sodium DNA product. What that allows you to do is get the optimal result. So, widely studied product in PDRN with all different products on the market. The kind of standard is that a 2% is good, but a 3% is optimal. And that's what we have with Lumicin. And it's the only one here in the States. So.
Yes, it is, because I was using some other forms of sodium DNA, the PDRN, from other companies, and they can be anywhere from 1%, 2%, maybe even less than 1%. I had used one that was 1.5%. But when I found this one being 3%, if a little's good, more of that is better, right?
Definitely.
So what does that product do for the skin? I know that we do see it all over Instagram, and we're performing a lot of these services in our office. What does that actually do for your skin?
Yeah, so basically what this product is, it's a little DNA fragment that we extract from the salmon that essentially is almost the same as our own DNA. So it mimics the body's DNA. It's 95% compatible. So what that basically means is because we take a little fragment, our body says, oh no, my DNA is broken. I need to fix myself. So it just starts repairing. So it starts building collagen and elastin. It starts that repair process. So you could use this, as a post-laser treatment. You could use this with your Toskani Mesotherapy. You can use this a lot of different ways, but really it's triggering that skin response to fix itself. The other nice thing specifically with sodium DNA is that it also rehydrates the skin. So we're replenishing the skin, we are regenerating the skin tissue, and we're also rehydrating the skin. So a lot of times after these treatments, our skin needs that moisture back, and sodium DNA or salmon DNA is able to do that.
One thing we're doing with the product is we do a lot of CO2 laser resurfacing in the office. And I tell people, if you want optimum results and you want to cut your healing time from these aggressive laser resurfacing treatments, I suggest they do a few of these, like 2 or 3 weeks apart, maybe starting a couple of months before getting their CO2 laser, because the healthier your skin is going into a laser resurfacing treatment, the faster you're going to recover. And most of the people that are getting these resurfacing treatments done, their skin is dry and dehydrated because they're more mature skinned people. So do you find that you're seeing that it does enhance the healing time, the wound healing?
Yes. So with a CO2 laser, as we know, that's looking for water in the skin to remove those outer layers. Now, if your skin is very dehydrated and there's less water in the skin, you're not going to get as good of a result from your CO2, right? So it's a great way to prep and really prepare the skin for those treatments. And then on the back end afterwards, it's also a great way to rehydrate the skin, because now we've evaporated from all of that water in the tissue to remove that outer skin. So we need to prep, but then we also need to repair afterwards.
So how long after a CO2 laser resurfacing would you think that it would be a good time to do that?
It depends on how deep you're going. So typically with more of a mild CO2, you could put Lumicin on right away, same day. If you're doing a very deep treatment, you may want to wait 5 to 7 days for that skin to re-epithelialize a little bit better before you apply anything onto the skin. It really just depends.
Yeah, definitely. So if they were going to come in for mesoneedling with the PDRN post a CO2 resurfacing, what do you think? Maybe 3 weeks later would be about a good time to do that?
Yeah, I think it depends on, how aggressive you're being with your treatment, of
always,
course.
yeah.
It could really be anywhere from 2 to 4 weeks out, depending. If you're just doing kind of a mini CO2, 2 or 3 weeks may be enough. If you're going a little bit more aggressive, for even up to 8 weeks if you're doing a very aggressive one.
Okay.
Yeah.
All right. So let's talk a little bit more about these products that are here on the table. We have some cocktails here. So I know one of them is the cocktail which will enhance scalp health, which is going to benefit people who are struggling with thinning hair, losing hair, dry hair, breaking hair, things like that. So let's talk a little bit about that.
So the Hair Cocktail Plus and the HCPR are those cocktails which you have at Kiss Me Med Spa. So these both work a little bit differently, but they're both combined together to get the best benefit for our scalp health and hair growth. So the Hair Cocktail Plus is able to actually stop the hair fall. So this is treating, really at the root. It's stimulating the follicles to grow more hair as well, but it's really, creating that environment where we're slowing down that cycle for the hair follicle, and we're stopping the hair from falling out. And then our HCPR, H for hair, is actually going in and strengthening those hair follicles, creating that nice protection for the follicle. So when you combine them together, we're tackling the hair loss from multiple avenues and creating hair growth as well.
Great. Now, how many treatments do you think it takes for, not that someone is completely bald? Okay, no, most things don't work for people like that. But let's say your hair is just starting to thin and you're noticing it maybe with menopause or even menopause, as we're all getting a little bit older. How many treatments do you think that it actually takes before people start to see less shedding, the hair thickening up a little bit?
Really, after the second or third treatment, you're going to see some results starting to form. After that second and third treatment, you're starting to see those smaller hairs coming out. But really what we recommend protocol-wise is to do a series of 10 treatments spaced 1 week apart. Okay,
so they're coming once a week for 10 times.
Yep.
Then after that, are they going on maintenance, or are they repeating another 10? What is the protocol typically?
Yeah, it's totally up to you. They can do maintenance, 8 to 12 weeks, one treatment. They can wait if, everything is looking good and they feel good about it. But usually 8 to 12 weeks is good because we still want to keep that hair from falling out, right? So even though we've done our due diligence and made sure that we grew that new hair, we want to make sure that they keep that new hair.
Yes, definitely. Yeah. So do you find that it even helps with the condition of the hair?
Yeah, so the HCPR is actually helping to strengthen the hair follicles, to thicken the hair. So the appearance of the hair is actually nicer as well. It's not just that we have more of it, but it's actually thicker, nicer hair as well.
Very nice. Yeah. Okay, well, let's take a look at this video that we have. Now, what you told me before we came on camera was that Toskani has partnered with some of the other companies out there. And what you're seeing here is our Fotona laser. We're doing 2 different modalities with our Fotona laser, and Lindsay has told me that Toskani has partnered with Fotona. Talk a little bit about that.
Yeah, so Fotona and Toskani are friends. We do a lot of events together because these treatments really do go hand in hand, and one enhances the other, right? So we never want to be just in a little bubble, because the body, the skin, ourselves, we are all complex beings, and we want to make sure that we're tackling things not only at the root cause, but really treating the symptoms too. So we're tackling it as more of a well-rounded approach.
Yes, and with our Fotona, we're doing 2 different modalities there. We're doing the smooth mode to stimulate blood flow there, and then we're doing the needleless microneedling, which is making little tiny microchannels in the scalp so that we can now massage in the Toskani product, and that is exactly what is in that little syringe there. And this was her first treatment, and surprisingly, she said it didn't hurt at all. I thought maybe that would hurt a little bit, but she said no, not at all. And we didn't use any numbing products or agents like that at all.
Perfect.
Yeah, so she is well on her way, and we'll be excited to get some before and afters on her. Okay, Lindsay, talk to me a little bit about what type of skin conditions that we can actually treat with these products here.
It's pretty limitless, I would say. There are infinite possibilities with Toskani. All of our skin cocktails are meant to be mixed in any way that you'd like. So everything is created in our lab to be, really pH consistent, so that once you mix these together, nothing is denaturing anything else.
So they play nice together.
They sure do. They are all meant to be combined so that you can customize a treatment for your patient, because every one of us is totally different. Our skin health is different. Our environment is different. Our genetics are different. Our goals are different. So you can really treat anything, whether that's acne, rosacea, hyperpigmentation, fine lines and wrinkles. If we need some little tightening, whatever the case may be, even if it's just for the micronutrients with our NCPR, something, just as simple as skin health, you could do that as well. So really the combinations are endless. You can make any combo you want.
Yes, regarding the acne, I know we have protocols for people who are still struggling with acne, but there's also a protocol for people that we're treating the acne scars with. And we actually have a client who he's had 2 treatments now with the Exceed microneedling device, and we're treating his acne scars. And we had done microneedling, traditional microneedling on him a few times before. All of a sudden now with this, we're starting to see a change. Prior to that, we really didn't see much of anything happening.
That's amazing.
He is thrilled. I mean, he comes in and he says, look at my skin. Just look how much better my scars are looking. Because, acne scars are hard.
Definitely.
We tear the skin up to try to rebuild it back up. And sometimes we're successful, sometimes we're not. And if they're dark-skinned, it's very risky to do advanced, aggressive things on someone with dark skin. So with this, it's such a nice treatment, and it doesn't hurt, and it's shallow, and he's definitely seeing some difference. So that's very exciting.
Yes, absolutely. The scarring protocols, whether it's face, body, whatever it may be, with that RCPR, our Pure Skin for our acne scars and acne, there's so many products that you can combine together. The revitalizing, which you have as well. All of those work hand in hand to not only treat those scars, the old scars, but even new scarring as well, to prevent that and to improve it quickly.
Yeah, these are just amazing little cocktails, and they're fun to mix too. They're a lot of fun. Talk to me a little bit about what immediate and long-term effects that the clients can see from this treatment or these treatments.
Absolutely. So typically what you're going to see is even the next day, a lot of people will say, my skin is glowing more, those results will start to build. So you will see that the more treatments they do, the better and better it gets. It's kind of like that snowball effect, where those results compound on each other. So even that first day, you will see a result, but it's just going to keep getting better and better. And especially with a series.
Right. We've seen people who, even after their first treatment with the PDRN, the Lumicin, glow, beautiful glow. And a couple of the nurses in the office, the clients are asking them, all right, what are you doing to your skin? And it's the Lumicin. That's what it is. And so that's making people book. And we're excited about more things to come from Toskani Med as they get more and more things FDA approved. There's going to be some skincare, correct, that's going to be coming?
Lots of things coming down the road. So Toskani in Europe has, about 300 products. Wow. Here in the US, we have just over 20 so far. So we're starting slow here, but we are adding all the time. There will be a lot of new things coming. But we're all working really hard behind the scenes to make sure we get all of those fun products out to you guys so you can continue to customize and treat all of the skin concerns that you see in your practice.
Yes, and we see a lot. So speaking to that, who is the ideal candidate for Toskani Med products?
Anyone with skin. So all of us need micronutrients, right? So there is no one that would not benefit, I should say. Now, there are a couple of things to watch out for. One would be anyone who's on Accutane.
Oh, definitely.
Yeah, we want to make sure that they are off Accutane for at least 6 months before doing any kind of invasive treatment like needling.
Absolutely.
Another would be during pregnancy and breastfeeding. It's not ethical to test on pregnant women or breastfeeding women, so none of these products have been studied on them. So we always say just hold off until you're finished, and then you can pick back up with your Toskani treatments after that. But realistically, these are good for everyone because they're just chock full of all those micronutrients that we need.
Right. It's like trying to say, who's a good candidate to take a vitamin or to take a supplement of some kind? Pretty much everybody.
Yeah.
So we have some more photos here we want to look at. Lindsay, what is this a photo of?
So this is an acne protocol. So these are all products that are at Kiss Me Med Spa right now. So our Pure Skin is always the base of all of our acne treatments. So that, of course, is part of the protocol. We have Lumicin here as well. And I believe this one has the revitalizing too. So a nice blend of different products that you're able to use to treat that acne and the inflammation that comes with acne, as well as controlling that sebum production.
Oh yes, because sebum we know is very inflammatory, and that's the culprit behind a lot of skin problems. So this photo right here, this is one of our nurses at the office, and when you came in to do our training, this is the protocol that we came up for Regina. So, and she's the one that everybody's commenting about her skin, right? So talk to us a little bit about those 4 products.
Yeah.
What are we putting in her skin?
Yeah, so the eCPR, so all of those CPR products that you see, the first letter kind of clues you into what you're getting. So the E on eCPR is for the eyes. So we did a treatment around her eyes, even on the lids. So that is really to plump up that tissue, rehydrate, treat puffiness, fine lines. So the eCPR was for her eye area. For the face, we use the Pure Skin, which is great for acne, oily skin, inflammation like rosacea. And then the WCPR, W is for whitening.
Right.
So we put that in there because she had concerns with pigment.
Right.
So we can combine those together to make sure that, you know, we're treating her pigment and her acne together. We don't have to wait. We can do it at the same
All
time.
at the same time.
And then, of course, our hero product, our Lumicin, as kind of our base that we use with almost every protocol unless someone is allergic to salmon or shellfish.
Right, and I've only had one person tell me, I'm allergic to salmon. Can I do this? I'm like, no, you can't do it.
Unfortunately, no.
Yes. So once again, the Lumicin, the sodium DNA, the salmon sperm, what people like to call it, you have the strongest formula out there available on the market. Is that correct?
Yes. Yes, it is wonderful. It works really well, but it's also very tolerable. Because it's healing the skin, it's not causing a reaction that would be negative for the patient. So you can use it really on any patient, and they're going to see that redness coming down after treatments. They're going to see that production of collagen and elastin. You know, I had actually an aura reading from that device taken of me before I did my last Toskani.
Yes.
And I did one at day 10 after my Toskani mesotherapy session. And I had improvements in the redness because I used the rosacea protocol with the Pure Skin. I had improvements in my pigment from the WCPR. I had improvements in my volume, even slight increase in my volume in my skin. And even a little bit of lifting was visible there. So you could see all of that from my before and my after just at 10 days. So imagine as someone's doing a series, the more they do, the better all those things are getting. We can see measurable differences. And you'll see those in a lot of our clinical trials as well.
Great.
Yeah.
So Lindsay, what is the next step or the first step for someone who wants to get these things done or to give this a try?
Yeah, well, to call you first, right?
That's right.
Call Karen
definitely.
at Kiss Me Med Spa. They have these products here in the Fresno area and are able to do all of these treatments. So you have a nice wide variety of Toskani products so that you can really be extra customizable, personalized for every single person.
We really love doing that. Well, I hope that you have gotten as excited about these products as we at Kiss Me Med Spa are. And I want to thank you, Lindsay, for coming today and talking to us about your products. And as always, if you have any questions or concerns about what you would like to do what treatments you'd like to try, please don't hesitate to call us and we will gladly get you in for a consultation. Lindsay, thank you once again for driving up to Fresno to talk to us about your products.
Thank you.
I'm Nurse Karen. This is Lindsay from Barrow Aesthetics, and I'll see you next time on the Toskani Med Spa Show. Bye-bye.